Hi, my name is Brittany Gonzalez. I will be giving a speech today on Florence Nightingale on infection control. Could you imagine finding out that your home was built on a contaminated cesspit and you were bathing in and drinking your own sewage? I can't, and neither could Florence Nightingale. When she was told by a pope that the building where she was caring for patients was, and that was the reason why no one was getting better. Florence Nightingale was a nurse in the 19th century when women were considered to be incapable of having a job. She was at a constant battle to prove society wrong. It is because of Florence Nightingale that infection control is now used in hospitals. The purpose of my speech today is to inform you of the contributions that Florence Nightingale gave to healthcare. She is the founder of modern nursing profession, and I know that I want to be as determined and dedicated as she was when I become a nurse. Over the next couple of minutes, I will tell you how Florence managed to run a hospital with virtually no food or supplies, discover the importance of sanitation, and realize how sterile equipment and cleaning supplies was important. First of all, my first point explains how Florence struggled caring for her soldiers because she was considered unfit for her job. Many people ignored her plea for more food and supplies. This did not stop her. She broke into stores at times and took supplies she needed because it felt inhumane for her to decide who to be treated and who not to be treated. But because of the lack of food, soldiers had poor immune systems. There were not enough antibiotics or medicine to help soldiers fight infection or get better, but she treated the ones that were worst off. I have this picture of Florence Nightingale, and the bottom says, "I attribute my success to this, and I never gave or took any excuse." And in the picture, I don't know if you can see it, but there's a bunch of soldiers around a bed and just Florence Nightingale, and it just kind of shows how she really had no help or support, and yet she still managed to care for so many patients. Now let's turn to the second reason why infection control is important. Florence knew that it was important to have good hygiene and hand washing. She discovered the importance of sanitation. So she would make sure to clean up and have the soldiers bathe. But like I mentioned earlier, that did no good because the water she was using was unsanitary. Soldiers with open wounds got quickly infected because organisms had an easy portal of entry. But back then, society did not know about germs and bacteria. Now soldiers do all that they can to prevent infection. They have immunizations and good hand hygiene. Furthermore, I come to the most important contribution of infection control. Florence realized how sterile equipment and cleaning supplies was important. She had never thought about sterilizing her utensils between surgeries or operations. But now for surgeries, since you're dealing with open wounds, you're being exposed to microbes, so having a room that is free from microbes is important. Society now is aware that cleaning blood or soiled objects is a good idea. Also, for different patients, it was important to clean equipment before and after use. Things need to be disinfected and sterilized between each procedure. This became known as aseptic technique, which means any healthcare procedure in which added precautions are used to prevent contamination of a person, object, or area by microorganism. In conclusion, many of the things that we know today are because of Florence Nightingale. She is a remarkable lady that helped the medical field greatly. Today we know precautions must be taken for both the patient and caregiver, and it is because of her. Today we know precautions must be taken for both the patient and caregiver, and it is because of her. She was an inspirational nurse that stood up to what she believed in when no one believed in her. You now understand how Florence managed to run a hospital with no food or supplies, discover the importance of sanitation, and realize how sterile equipment and cleaning supplies were important. I encourage you to think about Florence Nightingale's contributions to healthcare and what the fertility rate would be today if infection control was not known.